Hi, good afternoon, everyone, and welcome to what is a very special episode of Medicare 360 radio show. I'm Jennifer Alfonso Lee, and today is unlike any show we've done before. Over the years, we've talked about everything from Medicare enrollment, Medicare Advantage, Medicare supplements, prescription drug plans, dental insurance, covered California, Social Security, appeals, prior authorizations, doctor networks, long term care, caregiving, and so much more. We've laughed together, we've learned together, um, we've solved problems together, and hopefully, we've helped thousands of families make better decisions. Today isn't about one Medicare topic. Today is about the journey, the lessons, the people I've met, the mistakes I've witnessed, the victories we've celebrated, and what I hope every listener remembers long after this program ends. This isn't a goodbye forever, it's simply the end of one chapter. And I thought there would be no better way to close this chapter than by sharing what more than 2 decades in this industry have taught me. So let's dive into it. Lesson number one. Medicare is never just about insurance. When I first entered this business, I thought I sold insurance. I quickly realized I didn't. I help people through some of the biggest transitions of their lives: turning 65, retiring, losing a spouse, receiving a difficult diagnosis, moving closer to family, caring for aging parents. Every Medicare decision comes with a life story behind it. One client wasn't worried about copays. She was worried about seeing the same oncologist who had cared for her for years. Another gentleman wasn't asking about premiums. He wanted to know if his wife would still be taken care of after he was gone. Those conversations changed me. Insurance isn't paperwork, it's people. And just, I probably have talked about this before. I did get into Medicare industry because my in-laws had Medicare, and I just didn't understand why they kept changing their plans every single year. And I actually really wanted them to get better care. Um, we were going to an office that had like cockroaches. And it was, they were friendly and great, but I was just like, maybe there's something better. And so that's why I deep dived. I'm like, I'm ready in life and health license. Why am I not helping them and others? Because it is quite confusing. Just another case. This past Saturday, I talked to one of my longtime clients, and unfortunately, my client, which is his wife, passed away, had a stroke, and she was the one who drives him places, right? So fortunately, they just got to their driveway and she got a stroke and went into a coma. They rushed her to the hospital, and they did testing, and she was half brain dead, which is very unfortunate. And then I think a few more days later, they pronounced her 100% brain dead. And so they said you could get another test result or lab done to be 100% sure. I believe their son lived a couple, maybe an hour or two away. So wanted to get him over here before they, had that final diagnosis. And which is just, I get it, right? My client just now doesn't want to live. And, he's not going to commit suicide, but he'd rather be with his wife. I mean, they were together for such a long time. But these conversations do change me. So it's really about the people. Um, when I meet someone, which, they're in a different plan, but they have to go on this other plan because, you know, they want the best back surgeon so they can walk their daughter down the aisle, or a client that just said, you know what, like, I think there's going to be a cancer diagnosis. I need a better plan. Um, just so many instances like that, where someone has cancer and just needs to be on the right plan. Like, I am definitely here for people to make sure that I could do what I can to help out the situation. Yeah, that's a little bit sad, but it's all about people. So, lesson number two, the biggest cost isn't always money. People often ask me, what's the biggest Medicare mistake? Most assume it's penalties, right? Or choosing the wrong plan. Sometimes it is, but more often, the biggest cost is stress. I've watched people lose sleep because they were overwhelmed by letters they didn't understand. I've seen adult children trying to coordinate care from another state. I met widows who suddenly had to make healthcare decisions alone. Education reduces fear. That's why this show has always existed. Knowledge creates confidence. So, yeah, I'd just say that just besides the insurance plan itself, just knowing that you have someone in your back corner that actually really does want to help you. Like an example is I just met a client recently, just turned 65 in January, was on a plan, and they're just like, we want to change to a different plan. So I met with them and then figured out that not that they didn't like their plan, it was because they had the wife had to see a physical therapist and the appointments were just taking months at a time. And so what we did is we definitely helped them call the medical group, figure out what vendors they could see for physical therapists, called a handful of those vendors to see if we could get a physical therapist sooner. And lo and behold, it is a little bit, maybe a couple cities further, but not much, maybe a 20-minute drive. We were able to get them that appointment. So it is definitely rewarding, helping, try to move things along. But of course, we're not going to know how to help if we don't know if there's a problem or issue. And the biggest thing is, cost wise, he didn't want to pay more in his plan. He didn't want to pay more co-pays in the case he went to the hospital. So hopefully for now, we've resolved this. His wife will get to see the physical therapist for her shoulder issues sooner than later. So yeah, like just stress like that. And that's why we're always here to help guide you in the right direction so you could have less overwhelm and less stress. Okay. So let's go over lesson number three. Every family is different. One of the greatest myths in Medicare is that there's one perfect plan. There isn't. I work with healthy retirees who rarely see a doctor. I've worked with clients managing diabetes, heart disease, cancer, Parkinson's disease, and multiple chronic conditions. Some travel the country in RVs, others never leave their hometown. Some value flexibility, other value predictability. The best plan isn't the plan your neighbor has, it's the one that fits your life. Yeah, so many times people ask, well, Jennifer, what is the best plan? It really is going to depend on your preference, how you want to receive care, when you want to receive it, where you want to receive it, right? So there's just so many factors. And I'm not here to tell anyone what to do, but to just guide the conversation and where what you want to happen does happen in the time that you need it the most. So that is, I mean, there's so many different types of people, so many different types of seniors. But that's what we're here for, to make sure that you get what you need when you need it. So let's go over lesson number 4, the stories I'll never forget. Um, so let's just say, like the gentleman who almost missed Medicare because he assumed it was automatic. I had a client who basically had some heart conditions. He missed his deadline for a supplemental at the 7th month mark, but we were able to get him something that at least instead of his no cap, he had a cap, right? Because if you didn't have coverage, you could be charged hundreds of thousands of dollars. And I'm just here to help you make that cap so you do not have to pay as much, and it could get someone bankrupt, right? Um, have helped just countless people with getting their Part B resolved. Sometimes Social Security does mess up and takes so many months to get your Part B. So just always following up and making sure that happens. One time, a husband who wanted to make sure his wife would be financially secure, something happened to him. We were able, um, upon his death, to give her his assets and life insurance, which, could keep the same level of lifestyle she has, right? Or just help out in that time. Because imagine if she didn't have anything. I've helped a lot of daughters and sons help with their aging parents navigate how this insurance works, doctor changes, and so forth. Just because, I mean, not everyone does this for a living, so I don't expect people to know, what's going on because this is not what they do for a living. So I have saved clients thousands because they just never looked at their plan, right? Like thousands of dollars because they didn't know they were paying into something they didn't have to pay for, or they were paying for an outdated plan or drug plan that they could get at zero cost. So things like that, definitely, we really are here to have a helping hand and to make sure that your life is easier. So let's go over lesson number 5. Healthcare keeps changing. So when I started in this industry, Medicare looked very different. Even during COVID, before that, many people were doing paper apps. That was just kind of the norm. But when COVID happened, it kind of accelerated us to technology and doing electronic and verbal applications. So like that's kind of one kind of getting out of that paper realm. Prescription drugs have changed, right? Based on the Inflation Reduction Act. The nice thing is that donut hole change, instead of having like a max of 8,000, the max out of pocket for prescription drugs that are covered is 2,100. It is going to go up. I believe the deductible is going to go up, unfortunately, but Medicare has picked like a bunch of drugs that most consumers take to make that more affordable. Also with insulin, right? That has definitely gone out with price. The GLP ones, that's kind of a big thing right now. But there's just so many prescription drugs changes, and it does change every single year. So it's always good to check and make sure your drugs are covered, and you know how much you're paying, so you're not surprised in the beginning of the year that you're paying more. Provider networks have been evolving. In Southern California, I mean, it's done well, right? Other states are catching on, But also, since in Southern California, provider networks have done well, there's been a lot of changes when it comes to the insurance aspect, to the contracts, because contracts do expire between the insurance company, between the medical groups. So there has been a lot of market disruption. And if you're just kind of living on a rock or don't even check your mail or don't even answer your agent's phone calls, you're not going to know. And you might be out of, the doctor, the medical group that you want to be in. So always keep up to date to that. Telehealth is becoming more mainstream, I would say, as well, right? Everything is going to the digital age. Um, AI is that's going to be kind of crazy. Most of the insurance companies now use AI, and you probably don't know that you are talking to someone that's a robot, right? Rules have changed, and they do change every single year. Sometimes not for the benefit of the agent that is helping clients, but because there has been a stream of let's just say overseas or uncompliant call centers that just want to make a quick buck with Medicare. So they flooded the market, making the agent's job harder because who do seniors trust, right? And so now there's more regulations in place, which is great, but hopefully not to the detriment of the agent that actually is not committing fraud, is being compliant. But we're being blamed by these call centers that are just changing people's plans without the care or knowledge of that person's certain situation. So just things like that that just change every single year. But one thing that hasn't is people still want someone they trust, right? That's the biggest thing. Trust is super important. With AI, I mean, maybe in our kids' generations, they're going to trust the robots. But right now, people trust people, right? Especially someone local. And maybe not, because I actually have many clients out of state as well. So someone who explains things in plain English, right? Like we don't need to go fancy. We don't need a robot. We just need someone that knows their stuff and cares for the person. And then someone who answers the phone, right? Like when you're dealing with these call centers or just like these big organizations, more than likely your agent is not going to be your agent. It was just a one and deal time that they enrolled you. When you call back, you're not going to get any help. And that's why a lot of clients stay with us or move to us because they know once they call, we'll pick up the phone and we will help, right? So that's the thing. And just the carriers right now, too, when you call, it's like how many automation to get you to the right person, and then it's still wrong. I mean, I see that all the time. It's pretty crazy. Okay. So someone who puts education ahead of sales, this has been changing. It has been growing, and where, as a business, insurance companies are not making or profitable in different types of plans. So they're holding back, and plans are not commissionable for agents and so forth. But I have still been helping clients. I don't get paid for their plans just because I know if that's the right plan for them, I should do that, right? So that's always been my goal. I have to sleep at night knowing that I did the best for the consumer, the senior, and I am a fiduciary. So, lesson number 6, what I hope you remember is if I could leave every listener with just a few pieces of advice, they would be these. Don't wait until you're sick to understand your Medicare. The biggest thing is just get it done. I know sometimes, like I have a client right now, I met with him a few years ago. I try to help him apply for Medicare online, but because I think he was already in that late period, he was over 65, he would have to call in or go to the Social Security office to get that done. He just called me recently, and he hasn't done anything, right? And it's just like, you need to go to Social Security or call them to get it done. We definitely help call with him, but the unfortunate thing is Social Security does not want us to do three-way calls with clients anymore. So things like that, right? Don't wait, because either you're just going to have racked up bills that you're not going to pay, or you're going to ask for like some relief on it, and that's a stress on you, mentally. And then like having that, health scares too, right? That's physical. So keep that in mind. Read your Medicare mail. Sometimes I know clients go on vacation for months on end. They don't read their mail, but sometimes things are important, right? Like if you didn't pay for your plan or for your Medicare, they will cancel you out. And it just takes a lot more work to pay it and to reinstate it or to figure it out, and the stress of having no coverage, right? So ask questions. Biggest thing, if you have questions, just ask, right? Don't make decisions based solely on television commercials. Okay, like not everything on television commercials are real. First, second, it's going to be based on the county that you're in, your situation. If you're on Medicaid, Medi-Cal, if you have a chronic condition, some of those are just blatantly wrong. Like there's just no way an insurance company is going to give you $10,000 back. Okay. So keep that in mind. Choose advisors to educate, not pressure. I've had clients, I mean, they're my longtime clients, but they get a call. It was just the right time, right place. And they're like, okay, let me change. And what happened? They had surgery next week and they're not able to go. They had a specialist they had to go to, could not go. Things like that. So please, take it seriously, not change your plan just on a whim, just because someone called you and offered you more benefits. Include your family in important healthcare conversations, right? Be it that POA, and just kind of understanding like what your needs are, so they can understand if you are in a hospital and do need help and just can't do it yourself, right? Remember that your healthcare is one of your greatest assets, right? Obviously, your health is also important, the number one thing, mentally and physically, just get you up on there. But after that, your healthcare definitely is important as well. So before we close today's program, I simply want to say thank you. Thank you for inviting me into your homes, your cars, your morning routines, your lives. Whether you've listened to one episode or for a year, it truly has been an honor. Thank you to every client who trusted me, every physician who partnered with us, every caregiver, every listener who called with a question, every family who allowed me to help during an important chapter of their lives. I don't take that trust lightly. As we wrap up today's episode, I want to leave you with one final thought. Life changes, healthcare changes, retirement changes, but one thing never changes: the importance of treating people with kindness, with honesty, with patience, and with compassion. Those principles have guided every conversation I've had throughout my career. This isn't goodbye forever. It's just a pause. It's simply goodbye for now. I look forward to whatever chapter comes next. Until then, take care of your health, take care of your family, ask questions, stay informed, and remember, clarity always comes before coverage. Thank you for listening to Medicare 360. I'm Jennifer Alfonso Lee. God bless you, and I'll see you again soon.